Hi, my name is Dr. Joe Childs, and on this video I'm going to share with you some shocking information about fibromyalgia. What shocking information? Well, fibromyalgia is not a muscular problem. Fibromyalgia is a neurological problem. How do I know that? Well, there's literally hundreds of different research papers out there that prove fibromyalgia is a neurological problem. And with my 10 years of experience in treating patients with fibromyalgia, what I have found is that when you address this condition neurologically, when you address the individual that comes in by looking at their brain and nervous system, you simply get the best results. Now, why is this not common knowledge? Well, I think there's a few reasons. Number one, there's a certain stigma that surrounds patients with fibromyalgia and patients with chronic pain. And the average doctor that's treating patients with fibromyalgia gets pretty frustrated when they find that their patient does not respond to the first, second, or third drug that they're given. The other thing is there's never been a good drug for fibromyalgia, and there never will be a good drug for fibromyalgia. And the reason why these drugs are not effective, and I know you've been given anti-inflammatories and you've been given antidepressants and you've been given, patients have been given duralgesic patches and Lyrica and morphine and all these different drugs. The reason why these drugs are not effective is because they do not address the core underlying neurological issue that causes fibromyalgia. And the average patient with fibromyalgia, it's been studied, has been to 10 different doctors looking for answers. They've tried 10 different drugs. In our office, the record of a patient coming in with fibromyalgia was the patient was taking 20 different medications. And we were successful in getting that patient to be completely void of drugs. They got to a point where they didn't need any medication through our care. Now, in our office, we are different in our approach. Number one, we want to address you neurologically. Number two is our treatment philosophy. Our treatment philosophy is to treat the individual, not the diagnosis. Now, we're concerned about the diagnosis that you come in with, whether it's fibromyalgia, chronic fatigue, but in our office, we want to step back and we want to sit down with you and we want to understand you as an individual. We want to understand how this condition has been affecting you. So what I want to do now is I want to go in and I want to explain this neurological condition that I'm talking about that's causing all the problems with fibromyalgia. So this is a model of the brain, and when you look at this model, there are higher areas of the brain, which is known as the cortex, and there are lower areas of the brain, which is known as the cerebellum and the brainstem. Now, normally what happens is the cerebellum, this back part here, fires up to the brain, and what the brain does is it sends messages down to the lower brainstem. And the lower brainstem has a lot of different jobs, but one of the jobs is it slows down or mutes the upper brainstem. The upper brainstem, it's called the mesencephalon, is sort of like an unruly teenager in that it needs a lot of supervision. And when it does not get this supervision, it can create a lot of havoc in the body. It can create the symptoms of fibromyalgia. What kind of symptoms am I talking about? Well, number one, insomnia. Patients with fibromyalgia have chronic fatigue and insomnia. That's because that upper brainstem is firing too fast. It is the center of the sympathetic nervous system, so if it's going too fast, your heart can race. A lot of patients with fibromyalgia notice that their heart races. The other thing that it can do is it can affect the way the blood vessels function in the brain. It can create migraine headaches. When the upper brainstem is firing too fast and the lower brainstem is firing too slow, you can get irritable bowel syndrome. You can get constipation, diarrhea. Chronic pain can happen because the upper brainstem stimulates pain fibers all through the body. Patients with fibromyalgia will feel like they have this sort of fibrofog or this brain fog where they're not as clear as they used to be. They can't think as well. They're not able to express the things that they would like to say. So these are some of the things that happen when you have that high-firing upper brainstem, and the brain is responsible for all of these issues. So when you treat fibromyalgia, you have to address it neurologically. Now, how do we find out if you have this high-firing upper brainstem? Well, we employ some very specific, specialized neurological testing that allows us to hone in and look at areas of your nervous system that other doctors are simply not looking at. And if we can find that this is present, this high-firing upper brainstem, we can help you. The other thing we want to do is we want to employ different types of specific brain-based therapies to get your nervous system functioning better. So in our office, we're not just going to give you another medication or give you some secret vitamin like most doctors have done. What we're going to do is we're going to get in there, we're going to find out how your brain and nervous system is working, and we're going to devise a plan to get your nervous system working better. Our job is to do all we can do to get your body functioning better and get your nervous system functioning better. So what you need to do is you need to find a doctor that will sit down with you, knee to knee, toe to toe, and listen to your problems. Find out who you are, how this problem has been affecting your life. Not just push you aside, give you another medication, tell you to come back in 30 days or come back in 3 months. What we want to do is we want to find out why you're having the problem. So if you're interested in finding out more information about how we help patients with fibromyalgia, what you can do is you can go right below this video and there's an area where you can plug in your information. And after you plug in your information, what we'll do is we'll email you out or send you out a written report, a 12-page written report that will go over our therapies, our treatments, our successes in detail. And let's talk about the successes. What are some of the successes? What are some of the benefits we're finding? Well, it's pretty amazing. Our patients with fibromyalgia, they're sleeping better, they're taking less medication, their chronic pain is reducing and eventually going away. Patients with patches or pain patches are noticing that they don't need to use the pain patches anymore. Their irritable bowel syndrome is reducing. So if you want to find out exactly what we do to get patients doing better with fibromyalgia, we'll send you out that DVD. The DVD we're going to send you is going to be a full-length DVD. It's about a 25 to 30-minute DVD. It's going to go over exactly what we do. We'll give you a tour of our office and show you how we help patients with fibromyalgia. So plug in your information and we'll get that information out to you. Thanks a lot.